Which section of the SOAP note is used to record the provider's measurable observations during the patient visit? A. Subjective. B. Objective. C. Assessment. D. Plan. Answer: B. The objective section contains measurable data, such as vital signs and physical exam findings, directly observed by the provider. A medication order reads, give 1 g of cefazolin for. How many milligrams should be administered? A. 10 milligrams. B. 100 milligrams. C. 1000 milligrams. D. 0.01 milligrams. Answer: C. 1 gram is equal to 1000 milligrams, so 1000 milligrams of cefazolin should be given. When using a Snellen chart, a result of 20/70 indicates that A. The patient sees at 20 feet what a person with normal vision sees at 70 feet. B. The patient sees at 70 feet what is normal at 20 feet. C. The patient has excellent visual acuity. D. The patient has perfect near vision. Answer: A. 20/70 vision means the patient sees at 20 feet what a person with normal vision can see from 70 feet away. Which of the following laboratory results should be reported immediately to the provider? A. Hemoglobin A1C of 5.8%. B. Platelet count of 200,000/L. C. Fasting blood glucose of 42 mg per deciliter. D. Total cholesterol of 190 mg per deciliter. Answer: C. A fasting blood glucose of 42 mg per deciliter is dangerously low and indicates hypoglycemia, requiring immediate attention. Which of the following positions is most appropriate for a rectal temperature measurement in an infant? A. Supine. B. Fowler's. C. Sims. D. Lithotomy. Answer: C. Sims position allows access to the rectum for temperature measurement or medication administration. What is the primary purpose of calibrating an autoclave regularly? A. To ensure proper sterilization of instruments. B. To prevent power failure. C. To adjust water pressure. D. To improve temperature display. Answer: A. Autoclaves must be calibrated to maintain proper temperature and pressure to achieve full sterilization. When performing venipuncture, which vein is preferred in the antecubital area? A. Basilic. B. Radial. C. Cephalic. D. Median cubital. Answer: D. The median cubital vein is the most accessible and has the lowest risk of complications. Which type of immunity is acquired after receiving a vaccination? A. Innate. B. Passive. C. Artificial active. D. Natural passive. Answer: C. Vaccinations stimulate the body to produce its own antibodies, providing artificial active immunity. A patient reports chest pain while seated in the waiting area. What is your first action? A. Notify the physician immediately. B. Ask the patient to wait. C. Document the complaint in their chart. D. Take their insurance card. Answer: A. Chest pain may indicate a cardiac emergency. Notify the provider without delay. The abbreviation SIG on a prescription refers to A. Signature of the provider. B. Sign or symptom. C. Instructions for the patient. D. Significant side effects. Answer: C. SIG, from Latin signa, refers to the directions to be followed by the patient. What is the most appropriate response if a patient refuses a treatment? A. Insist the patient receive care. B. Document the refusal and inform the provider. C. Ignore the refusal. D. Discharge the patient immediately. Answer B. Patient refusal must be documented accurately, and the provider should be notified to ensure proper follow-up. Which of the following best describes the function of insulin? A. Decreases stomach acid. B. Increases blood pressure. C. Regulates blood glucose levels. D. Stimulates red blood cell production. Answer C. Insulin helps lower blood glucose by facilitating the uptake of glucose into cells. Which of the following is considered a violation of patient confidentiality? A. Discussing lab results with the provider. B. Giving patient information to a friend without consent. C. Documenting treatment in the patient's chart. D. Updating a family member listed on the consent form. Answer B. Sharing patient information without proper consent violates HIPAA. Which of the following must a medical assistant verify before administering any medication? A. Expiration date. B. Patient's identity. C. Correct dosage. D. All of the above. Answer D. All elements must be verified to ensure safe and accurate medication administration. Which body system is primarily assessed using spirometry? A. Digestive. B. Respiratory. C. Nervous. D. Endocrine. Answer B. Spirometry measures lung function and is used to assess respiratory conditions like asthma and COPD. Which term describes difficulty swallowing? A. Dysphagia. B. Dyspnea. C. Dysuria. D. Dystrophy. Answer A. Dysphagia refers to difficulty or discomfort in swallowing. Which of the following actions is most appropriate during a suture removal procedure? A. Apply alcohol to the suture site. B. Pull the knot through the skin. C. Cut below the knot to avoid dragging contaminated suture. D. Reuse the same gloves between patients. Answer C. Cutting below the knot prevents the external portion of the suture from being pulled through the wound. Which of the following is a CLIA-waived test commonly performed in a physician's office? A. Glucose finger stick. B. Blood culture. C. Throat culture. D. Sedimentation rate. Answer A. Glucose fingerstick testing is simple, low risk, and CLIA waived. Which is the correct technique for handling a blood specimen for serum separation? A. Place on ice immediately. B. Spin without clotting. C. Let clot before centrifuging. D. Store in freezer before testing. Answer C. Blood must clot before centrifugation to separate serum from cells. When sterilizing surgical instruments, what packaging material is commonly used? A. Cotton. B. Autoclave paper. C. Plastic wrap. D. Paper towels. Answer B. Autoclave paper allows steam to penetrate while maintaining sterility. Which medical abbreviation means after meals? A. PC. B. AC. C. HS. D. PRN. Answer A. PC stands for post-sibum, meaning after meals. The universal safety color for biohazard waste containers is A. Green. B. Yellow. C. Blue. D. Red. Answer D. Red is the universal color for biohazard containers and sharps disposal. The abbreviation MI refers to which medical condition? A. Migraine inflammation. B. Myocardial infarction. C. Multiple injuries. D. Muscular irritation. Answer B. MI stands for myocardial infarction, commonly known as a heart attack. Which of the following would be an example of an open-ended question? A. Can you describe your symptoms? B. Is your chest pain gone? C. Are you feeling better today? D. Do you have any questions? Answer A. Open-ended questions encourage patients to provide detailed answers. What should be done if a medical assistant encounters a fire in the facility? A. Run outside immediately. B. Finish current tasks first. C. Follow the race protocol. D. Call a coworker. Answer C. RACE stands for rescue, alarm, contain, extinguish, used during fire emergencies. Which blood-borne pathogen poses the highest transmission risk from a needle stick? A. HBV. B. HCV. C. HIV. D. CMV. Answer A. HBV, hepatitis B virus, has the highest transmission risk via needle stick injuries. Which body organ is primarily responsible for detoxifying chemicals and drugs? A. Kidney. B. Spleen. C. Liver. D. Pancreas. Answer C. The liver plays a key role in metabolizing and detoxifying substances. What is the normal adult range for oral temperature? A. 96.0 to 96.5 degrees Fahrenheit. B. 97.0 to 99.0 degrees Fahrenheit. C. 99.5 to 101.5 degrees Fahrenheit. D. 100.0 to 102.0 degrees Fahrenheit. Answer B. Normal oral temperature typically ranges from 97 degrees Fahrenheit to 99 degrees Fahrenheit. The legal term residential ipsa loquitur means A. The thing speaks for itself. B. First, do no harm. C. Let the decision stand. D. A matter decided. Answer A. It refers to obvious negligence where the facts speak for themselves. Which part of the prescription indicates how the medication is to be taken? A. Superscription. B. Subscription. C. Inscription. D. Signature. Answer D. The signature or sig includes the dosage and instructions for patient use. When documenting a blood pressure of 122/76 mmHg, what does 76 represent? A. Systolic pressure. B. Pulse rate. C. Diastolic pressure. D. Respiratory rate. Answer C. The diastolic pressure is the lower number and represents pressure during heart relaxation. What is the function of a centrifuge? A. Freeze blood samples. B. Separate components by density. C. Heat urine samples. D. Mix reagents. Answer B. Centrifuges spin at high speed to separate liquids based on density. When taking an axillary temperature, how long should the thermometer remain in place? A. 15 seconds. B. 30 seconds. C. 1 minute. D. 10 minutes. Answer C. Axillary temperature takes longer and requires at least 1 minute for accuracy. A hematology test that evaluates the percentage of red blood cells is called A. Hemoglobin. B. Hematocrit. C. Platelet count. D. Sedimentation rate. Answer B. Hematocrit measures the proportion of red blood cells to total blood volume. When performing ear irrigation, what temperature should the solution be? A. Cold. B. Hot. C. Room temperature. D. Body temperature. Answer D. Body temperature solution prevents vertigo or discomfort during irrigation. Which type of microorganism causes athlete's foot? A. Virus. B. Bacteria. C. Fungus. D. Protozoa. Answer C. Athlete's foot is a fungal infection caused by tinea pedis. A common side effect of corticosteroids includes A. Immunosuppression. B. Weight loss. C. Hypoglycemia. D. Increased urination. Answer A. Corticosteroids suppress the immune system and may increase infection risk. The metric prefix milli- means A. 1/10. B. 100th. C. 1000th. D. 1/millionth. Answer C. Milli- denotes 1000th, as in milligram equals 1/1000 of a gram. Which of the following routes allows for the slowest absorption rate? A. 4. B. IM. C. Subcutaneous. D. Oral. Answer D. Oral medications must be digested and metabolized, resulting in slower absorption. Which of the following patient statements indicates a need for further teaching? A. I'll take my antibiotic until it's finished. B. I'll take my BP pill at the same time every day. C. I can stop the steroid if I feel better tomorrow. D. I should refrigerate my insulin. Answer C. Steroids should never be stopped abruptly without provider guidance. In a standard EKG, which lead is considered ground? A. Left arm. B. Right leg. C. Left leg. D. Right arm. Answer B. The right leg electrode serves as the ground in EKG tracings. The primary function of OSHA is to A. Manage health insurance. B. Protect workers from job-related hazards. C. Regulate controlled substances. D. Monitor hospital performance. Answer B. OSHA ensures safe working conditions and enforces safety standards. A patient faints after blood draw. What should you do first? A. Offer water. B. Call 911. C. Lower the patient's head and elevate legs. D. Begin CPR. Answer C. Fainting is often due to low blood flow to the brain. Elevating the legs helps restore circulation. What should be done with outdated medical supplies? A. Use them if unopened. B. Discard them according to office protocol. C. Donate them. D. Return them to the patient. Answer B. Expired items may not be safe or sterile and must be disposed of properly. What term describes a surgical removal of the gallbladder? A. Appendectomy. B. Nephrectomy. C. Hysterectomy. D. Cholecystectomy. Answer D. Chole equals bile, cyst equals sac, ectomy equals removal, cholecystectomy is gallbladder removal. Which of the following describes the term cyanosis? A. Yellowing of the skin. B. Bluish discoloration of the skin. C. Redness of the skin. D. Flaky skin. Answer B. Cyanosis is due to lack of oxygen in the blood, resulting in a blue tint to skin. The process of measuring a medication dose using body weight is called A. Empiric dosing. B. therapeutic dosing. C. Weight-based dosing. D. Prophylactic dosing. Answer: C. Doses for certain medications, especially pediatric, are calculated per kg of body weight. In which section of the medical record would allergies be documented? A. Assessment. B. Family history. C. Problem list. D. Medication list. Answer: C. Allergies are typically listed in the problem list or patient summary for quick access. Which of the following terms means inflammation of the liver? A. Nephritis. B. Hepatitis. C. Gastritis. D. Colitis. Answer: B. Hepat- refers to the liver, and itis indicates inflammation. Which of the following pulse sites is located on the wrist, near the thumb? A. Carotid. B. Femoral. C. Radial. D. Popliteal. Answer: C. The radial pulse is the most common site for routine pulse monitoring and is found at the wrist.